The Ministry of Health says it is investigating claims that antiretroviral drugs, ARVs, phased out in the country were flagged off by KEMSA last week for distribution to 31 counties. And even though Health Cabinet Secretary Mutahi Kagwe has given the assurance that ARVs held at the port of Mombasa will be released, the United States, through its Secretary of State, Anthony Blinken, has maintained that American aid will continue only if the government addresses issues of corruption in KEMSA. Let's get more from our very own Dorcas Mungira.
The United States, for the first time, has declared its stand on the matter.
And good evening.
U.S. Secretary of State Antony J. Blinken, speaking to Citizen TV, saying corruption at KEMSA was the elephant in the room.
Concerns in particular about corruption that I know the government is working to reform. We have an obligation to our own taxpayers when we're spending their money.
USAID refused to release the consignment, demanding that a private US-based company, Chemonix International, be the distributor before the drugs are released. Kagwe saying ongoing talks would change the situation.
We are now discussing the issue of disbursement and the issue of distribution of the same. So we have no doubt that in the coming number of days, the ARV shortages here will be a thing of the past.
Secretary of State Blinken saying USAID's assistance to people living with HIV would continue in an environment of accountability and transparency on KEMSA's part, saying this had been discussed with President Uhuru Kenyatta.
As KEMSA was being reformed, nothing fell through the cracks, that we had the ability together to make sure that our assistance continued uninterrupted.
However, Kenyans living with HIV such as Anne Rono and Josephat Amoshe in Nandi worry about their supply of life-saving ARVs. KEMSA on Thursday last week flagged off ARV drugs in 24,800 packs worth 1.2 billion shillings to 31 counties. On Tuesday, another consignment was flagged off from Kisumu to the remaining 16 counties. Neither Rono nor Amoshe have received new supplies.
As people living with HIV in Nandi, we are worried. Because we don't know after May what will happen. If the issue of the government with US aid will continue, we don't know where we are going to run into.
Mutahi kwake akisema kwamba dawa zimeingia, lakini hapa Nandi bado hatujaona. Tunashindwa tutafanyaje ili turudie maisha ya kawaida, na tunahofia kwa maana hizi dawa zikikosa hatutaishi.
NEFAC, the National Empowerment Network of people living with HIV and AIDS and other organizations, say the drugs flagged off were old stock donated by the Global Fund under PEPFAR, phased out in the recent past due to adverse side effects on patients. The drugs included nevirapine syrup for children and nevirapine tablets for adults given as a single drug or as part of a 3-drug fixed-dose combination, as well as zidovudine and lamivudine. Nevirapine's common side effects include abdominal pain, rash, fatigue, headache, vomiting and muscle pain, and it is closely linked to liver failure. HIV high-burden countries in sub-Saharan Africa have adopted dolutegravir instead. The Ministry of Health says it is investigating these claims.
We are investigating everything. Yes, we have had 2 issues with the ARVs. One of them is obviously the change in the ARVs to use.
258,954 packs of tenofovir, lamivudine, dolutegravir ARVs donated by USAID are still withheld at the port of Mombasa since the 18th of January. For the 1.2 million people living with HIV like Anne and Joseph, little reassures them that they will have the drugs that they need to sustain their lives. Dorcas Mungira, Citizen TV, Nairobi.